1450 WCTC.
It is 8:09. Welcome to hour number 3 of Jersey Central on the new Talk Radio 1450 WCTC, the voice of Central Jersey. I am Burt Barron. Good morning to you. Welcome back inside the Forge Jeweler Studios. We'll do our contest coming up a little bit later on. In fact, we'll do it sometime between now and 8:30. Burt's Backwards Oldie. Your chance to win tickets to the Golden Oldies Spectacular, returning to the State Theater in New Brunswick on Saturday, November 12th. And also a bonus prize. I've got not one, not two, but 6 gold full-service car washes for PJ's Car Wash in Spring Lake Heights that I'm going to give away as a bonus prize for today's winner. So we'll play the contest coming up in just a little bit. Well, the statistics, when you think about it, pretty startling. Nearly 27 million Americans suffer from joint pain caused by osteoarthritis, most frequently found in the knee, especially in adults over age 45, and that's the demographic that I fall into. More common in women than men, which I didn't know, and more prevalent among athletes or people who take part in extreme sports. And joining me here on the Jersey Central Newsmaker Hotline, which is some information about the effects of osteoarthritis and how we can keep our knees healthy for longer, let's welcome in Dr. Vinod Dasa, who's with us here on WCTC. Dr. Dasa, good morning. It's Burt Barron. How are you?
Good morning. Thanks for having me.
I'm a Jets fan, and I saw what happened to the quarterback, Geno Smith, injuring his knee and ending his season in the game on Sunday. So I thought this was a perfect time to get someone on to talk about the knee. Just such a fragile joint, isn't it, Doctor?
Yeah, and it's prone to injury, like you mentioned, especially patients that do high impact sports like football. It's not uncommon.
And it's just not built. It seems like it's not built for any sort of collision or contact sport, is it?
Yeah, especially when you get hit from the side, it's very unforgiving. But yeah, you're right. It's got a lot of challenges.
This knee cartilage wear down and the loss of the fluid that keeps the knee joint lubricated. Is that something that every person will experience in their lifetime, Doctor?
Yeah, so over time, if you stay healthy and fit, the risk of developing arthritis and having pain and symptoms from it is much less. We know that if you're obese or you have medical conditions like diabetes and some other things, the risk of progression to arthritis is higher, especially those that injure themselves, like you said, meniscus tears, ligament injuries, things like that. You'll develop arthritis usually at an earlier age, or have it become more severe depending on what all these risk factors are.
And it seems like you had mentioned too about the obesity problem. Boy, just dropping a couple of pounds really takes a lot of the stress off of our knee joints, doesn't it?
Yes, and it's not just 1-to-1; it's actually 4-to-1. So the more weight you lose, the less stress, the tremendous amount of less stress that your joints will see.
Boy, that's great news right there. If that doesn't want to make anybody drop a few pounds to keep the knees strong and healthy, I don't know what does. Can the knee joint be strengthened like a muscle, Doctor? It doesn't work that way, does it?
So no, not necessarily, but to your point, if you keep the muscles strong around the knee, so for example, the ones in your thigh, the hamstrings and your thigh muscles, your quadricep muscles, keeping those healthy and strong can help provide stability and support for the knee, which then lowers the risks of having knee injuries and potentially maintaining the life of the knee. So staying healthy and strong is extremely important for the knee. There
are a lot of drugs on the market, Doctor. We see them all the time, pain relievers and these anti-inflammatory medications, I guess NSAIDs they call them. Are they effective, and is there such a thing as being over-medicated by these over-the-counter things when it comes to knee pain?
Yeah, I mean, you have to be careful. Anti-inflammatories, like you said, have a lot of issues with them, whether it's cardiac risk factors or blood pressure. They can cause ulcers. If you're on blood thinners, you have to be very careful. So you have to really consult your doctor to make sure they're the right option for you. I like to break it down into 2 buckets. One is kind of early arthritis, so what we consider mild to moderate arthritis. The options are what most of your listeners are probably used to hearing about. Like you said, NSAIDs, Aleve, Advil, Tylenol, things like that. Next option could be knee braces, the knee sleeves like some of the athletes wear. A lot of patients with arthritis like wearing that. You want to wear soft sole shoes, sneakers, to help absorb some of the cushion and help the knee out with that. Oftentimes a lot of patients will actually do all this stuff before they actually come to see me. And so when they come to see me, we kind of have to step it up to the next level. And so when you have mild to moderate arthritis, the next step I'd like to use generally would be hyaluronic acid injections like Gelson, which was developed by Bioventus, who I'm speaking on behalf of today. And I like to use those injections because the basic science around them is pretty impressive in terms of helping preserve and protect the cartilage in the knee and hopefully get a knee that lasts a little longer. We actually published a research paper earlier this year looking at the impact of these injections on potentially delaying knee replacements. What we did is we used a huge insurance database to look and see when patients had knee replacement based on how many of these injections they received. And what we found is with patients that got these hyaluronic acid injections, we had a delay to knee replacement just over 3.5 years, depending on how many injections they received. Once those gel injections, hyaluronic acid injections, don't work well, then I typically move on to steroid injections, which most people are familiar with. The issue I have with steroid injections is at a basic science level, it's been shown that they can actually damage the cartilage cells that we're trying so hard to keep alive. And then ultimately, when nothing works, then the last option, which most people try to avoid, and I don't blame them, would be the bigger stuff like knee replacements.
Yeah, that's kind of an extreme, kind of a last resort at that point, isn't it, Doctor?
Yeah, and again, it's a function of patients' symptoms and their ability. We have patients who have bone-on-bone knee arthritis, but they're doing relatively well. Maybe they're not as active, and they don't use their knees as much, and it's not bothering them, or they're doing fine with injections. There's no need to jump to a knee replacement if you're doing relatively well. But a lot of patients have very active lifestyles. They don't want to give up their golfing or walking or shopping, traveling, grandkids, all the typical things. And so for them, the arthritis really gets in the way, and they need more options, and knee replacement is a really good solution at that point.
And it sounds like there are advantages to this injectable therapy you were talking about, where it's focused. It goes right to the area that it's treating. It's not any sort of oral medication or anything. This injectable goes right into the knee and goes to work immediately, I take it.
Yeah, you're right. And so when we take pills and things like that, it's what we call systemic therapy. So it runs the risk of going everywhere, not just the knee. And so when we give these injections directly into knee, all of that work, all of that energy is going right to the place that's having the most symptoms and having the problems. And so that's appealing to a lot of patients to know that what we're doing is specific to that area that's bothering them.
Some real good information. Is there a general website, Doctor, that you could recommend that just has maybe just an overview and some general information about osteoarthritis where people can go to get some info?
Yeah, two great resources. One is the American Academy of Orthopaedic Surgeons, and that website is called orthoinfo.org. And the second website is the American College of Rheumatology, and that website is rheumatology.org. Both great resources for patients.
Good information. So drop a few pounds and keep the leg muscles nice and strong, and you got a chance of having good, healthy knees for a long time. I guess that's what we want people to take away today, right?
That's correct.
Excellent stuff. Dr. Vinod Dasa, thank you for your time this morning. Great having you on WCTC Radio here in New Jersey, all right?
Take care.
All right, you have a great day. Thank you. All right, Dr. Dasa, some good information.